Hello, Dr. Scott, and anyone reviewing this assignment. Harriet A. Washington's Medical Apartheid book is a groundbreaking and unsettling exploration of the exploitation of African Americans in the U.S. medical system, both historically and in present times. The book traces the trajectory of medical experimentation and unethical practices beginning in the era of slavery and extending into what is known as the 21st century. It reveals how African Americans were treated as mere subjects for medical research, denied basic and human rights, and also subjected to unimaginable pain and suffering, all in the name of scientific progress. Through meticulous research, Washington sheds light on systemic racism embedded within the American healthcare system and examines critical events like the Tuskegee syphilis study and other unethical surgical practices performed on enslaved women. These practices were not only violations of human rights, but also laid the foundation for ongoing healthcare disparities and mistrust that African Americans still have to face within the medical field. My presentation, I hope, will unpack the major themes and arguments of the book, analyze the ethical implications of these practices, and explore the lasting impact that some of these practices have on our healthcare system even today. And I hope that it will also discuss the relevance of this history in addressing current health disparities and how, as a scholar, I can envision a more equitable future in medicine and how I may be able to contribute to that post graduation. One of the most striking themes presented in medical apartheid is the deeply entrenched nature of medical racism. This is a system that was built on the belief that black bodies were inherently different and less deserving of humane treatment. For example, very early on, researchers and professionals believed that black people were of, the ape species, and they would look at our lips and the enlargement of our nose in comparison with Europeans and say that, we were less than those because of those features. And so this systemic racism was fueled by pseudo-scientific ideologies that justified appalling and almost atrocious medical practices. For example, in the book, we learned that enslaved African Americans were often subjected to brutal experiments without anesthesia or consent, under the pretext that African Americans don't feel pain in the way that white Americans do. And this type of ideology significantly dehumanized black individuals and enabled a cultural belief that exploiting these black bodies was different because they were able to withstand pain, whereas other groups could not. And so, with this, the role of trusted institutions and medical authorities, such as hospitals and such as physicians, perpetrating these abuses was equally troubling. Um, from hospitals to research universities, these organizations sanctioned and carried out unethical practices. The infamous Tuskegee syphilis study, which I'll get into a little bit more, is a prime example, because of the black men and how they were misled and denied treatment for syphilis for decades, even after discovering how to treat it. These were events that were funded by government agencies, which showcase the systematic nature of these abuses. And this part brings us to the lasting legacy of distrust in the healthcare system that exists within the African American communities today. This distrust itself is not rooted in myth or paranoia. It stems from very real, very fact based traumatic events that span generations. I can think of my grandparents and my parents all never really forming a trusting relationship with their healthcare providers because of their fears based in a lot of the events discussed in this book. Um, we know research shows that black individuals today are less likely to seek medical care or participate in clinical trials, which I'll also get into a little bit later in this presentation. Not because they don't value their health, but because history has taught them to be cautious and to consider systematic issues with accessing these resources. You know, mistrust compounds existing healthcare disparities because blacks often report inadequate pain management. Again, looking back on how these physicians performing surgeries back in the slavery era didn't administer medication. They just performed surgeries assuming that black bodies could take this type of abuse and mistreatment. So the book provides a great understanding of this historical context, which we can better address the challenges of rebuilding trust and ensuring equity in modern healthcare practices. But that only comes when we acknowledge the painful past in order to create a more inclusive future. One of the first highlighted practitioners, and I would say, in my opinion, most egregious figures highlighted in the discussions of medical racism is Dr. J. Marion Sims. He has been historically referred to as the father of modern gynecology. And while his contributions to medical science are undeniable, they came at a cost paid by the bodies and suffering of enslaved African American women. During the 1840s, Sims conducted experimental surgeries on African American women without their consent and without anesthesia because he believed that African American couldn't feel pain at the same rate as non blacks. These women had no rights because they were under the institution of slavery, and so their slave masters were able to speak and make decisions for them, even involving their own body in medical care. They were forced to endure unimaginable pain because Dr. Sims is first very well known for his treatment for vaginal fistulas, which were a complication often caused by prolonged labor, which primarily impacted African Americans and slaves due to their poor health care during pregnancy, um, the likelihood that they would have to give birth to multiple children, the likelihood that they would have to give birth starting at a much younger age than other women. And so Washington highlighted during the book that blacks were forced to deliver children um, to benefit their slave owners, right? It's economical. So when they were diagnosed with this condition, they would become incontinent to urine and feces, of course, making them difficult to provide labor. And Sims knew that by treating this condition, it would hail him to a high regard within the medical community. Um, so she went on to talk about how, Dr. Sims knew developing a solution to this would benefit him financially and did not care much about taking care of his tools to make sure that they were hygienic. He didn't care about ensuring that women could have anesthesia despite being available at the time because of his own rooted racist belief that black women could endure pain at a tremendous rate. One of the most harrowing accounts is that of Inarsha, an enslaved woman who Sims performed at least 30 surgeries on in his quest to perform his techniques. He also subjected many other slave women, some by the first name of Lucy and Betsy, to repeated surgical procedures under the same brutal conditions. And sometimes he made them even help in their own surgeries. He made them hold things during the procedures. Sometimes they had to be held down during the procedures, which in itself should have showed him that these women were in great pain and not able to bear it in the way that he once thought. Um, his experiments weren't just limited to the vaginal fistula surgeries. He's also been credited with a lot of work done in cesarean procedures, although there has been evidence presented that that was actually um, kind of the expertise actually came from Africans, but just the procedure itself. But he also experimented with cesarean sections on women that were slaved, further exploiting their bodies. And these practices were carried out without regard for physical or psychological trauma inflicted by Dr. Sims, which depicted the broader systematic abuse inherent in medical racism. These women were just seen as tools for advancing medical knowledge. And so I live in Florida where we're trying to block conversations about the past, but we have to tell the stories to honor the lives of these women and to ensure that others are able to recognize this history and so that these atrocities are never repeated so that we can advocate for ethical, inclusive, and medical practices. Washington also does a very great job covering the Tuskegee experiment and discussing how African bodies were essentially commodified and used for scientific curiosity. One of the darkest chapters in American medical history is the Tuskegee syphilis study, which is an egregious violation of ethics that underscores systematic racism that's embedded within healthcare. The study itself, conducted from 1932 to 1972 by the U.S. Public Health Service, a government agency, the experiment aimed to observe the untreated progression of syphilis in black men under the guise of providing them with free medical care, right? Was it free medical care? Absolutely not. Over 600 black men were recruited, and 399 of them had syphilis, and 201 of them did not. And they were falsely promised treatment and other benefits. The men were never adequately informed of the study's true purpose, and even after penicillin became the standard treatment for syphilis in 1947, the researchers deliberately withheld the drug, which was a life saving drug at the time, and many of the participants suffered severe complications. They died. They unknowingly passed the disease to their spouses and their children, making it a generational impact. And so, not only was this an ethical failure, but it was a deliberate exploitation of black lives for the sake of white dominated medical research. The Tuskegee experiment essentially revealed how black bodies were they were commodities, right? They were dehumanized and they were framed as mere tools for scientific inquiry rather than human beings deserving of dignity, deserving of care, deserving of respect. Um, Following the study's exposure, this is what led to a lot of the significant changes that we've seen in research ethics and policy. In 1974, Congress passed the National Research Act, which mandated the establishment of the IRB, or Institutional Review Boards. And these boards are now qualified and required for any federally funded research involving human participants. They ensure that studies meet ethical standards and protect the rights and welfare of participants. Where this did not exist, the egregiousness of the Tuskegee experiment led to this. And also, the Belmont Report, which was issued in 1979, outlined basic principles for ethical research, such as respect for persons, justice, and beneficence. So these principles guide informed consent procedures, which seek to lessen and minimize harm to those participating. The Tuskegee study, that legacy continues to shape modern policies in accountability in clinical research. However, the mistrust still remains in African American families. Just think about this COVID vaccine that came out in 2020. Most of us were hesitant because of the legacy and stark reminder of the healthcare system's lack of transparency and cultural competence when it comes to us. So a lot of people didn't want to get that shot. I think about the movie Mrs. Evers' Boys, which was based on this Tuskegee syphilis study. That movie came out in 1997 when I was 12 years old. And I was forming my own understanding of the world, of justice, of my identity. And I remember seeing the film and just feeling scared and confused and very untrusting of hospitals and doctors. And so, understanding the Tuskegee experiment as Washington has laid out for us in this book is not just about acknowledging past wrongs, but it's also a call to action in working collectively to rebuild trust in healthcare and advocate for policies to be in place so that such inhumane practices are never repeated. So let us now turn to the harrowing history of how African Americans were subjected to other inhumane medical experiments as documented extensively in medical apartheid. Um, the history is not just a footnote, right? It's not just a small footnote, but it's a chilling testament to how systemic racism has infiltrated the medical field and treating African Americans as expendables just in the pursuit of knowledge. One particularly egregious example is the radiation experiments conducted during the mid 20th centuries. African Americans, often poor and vulnerable, were exposed to high levels of radiation without their informed consent. And these experiments were framed as treatments or harmless studies. However, in reality, they resulted in inhumane and devastating health outcomes, which included burns, cancers, and long term damage that participants were never truly warned about. Similarly, pharmaceutical testing often targeted black individuals or African Americans, exploiting them under the guise of advancing medicine. So many African Americans were enlisted in drug trials without a complete understanding to the risk or the nature of the experiments that they were involved in. And they were treated as data points, right? And not as human beings. They suffered physical and emotional harm while these companies profited from their suffering and learned what would benefit non minority groups at the expense of minority groups. And so the use of African American bodies didn't stop at, just Tuskegee or the gynecological issues or practices that were highlighted largely in the book. For decades, black men and black women were systematically used for anatomy and surgical training. Their corpses were often stolen from graves or were acquired without proper consent. I had never thought about until it was discussed in this book what happened to slaves once they reach a point of incapacitation or where they could not be a benefit to their master, right? There's no retirement home, there's no nursing home. What happened to these people? Well, this book shed light on the fact that hospitals weren't these big scientific hubs back in the day, and they took care of people nobody else would take care of, but it wasn't in a humane way. And so these are just examples of, even when people died, their corpses were often stolen or acquired for science, for dissemination within these medical schools where the white professionals were. And, in life, individuals that were African American were just subjected to these advances, but at an unimaginable cost of black pain, trauma, and death. So, as we move forward in discussing medical apartheid, it's critical to understand the far reaching and lasting impacts of the dark history exposed in the book. The deep seated mistrust that many African Americans hold towards the healthcare system, it's not by accident. It's by clear consequence of generations of exploitative practices, um, where black bodies were used for science, not with consent, but through coercion and often outright deceit. And so, even when treatments could have been beneficial, even when lives could have been saved, African Americans were excluded from receiving them within clinical trials because they just wanted to see what was going to happen. And this distrust has modern implications that are visible in healthcare inequities today. Many African Americans are less likely to seek medical care not because they don't value health, but because they fear mistreatment, they fear neglect, they fear continued abuse within the medical system. And so it's not like these fears are unfounded. Black patients have also been shown to receive inadequate care when going to seek services for things like pain management, right? Here re enters the chat or the myth that black people have a higher pain tolerance. And so this has been proven that this is not just a bias. This isn't just an oversight. This is a continuation of this systemic discrimination and negative belief systems that African Americans are different than any other human race. And so while we also see pain management issues within medical systems, we also see high mortality rates within African American pregnancies and birth deliveries. Black mothers are far more likely to die during childbirth compared to their white counterparts. And more diseases also take a higher toll on African American communities like high blood pressure and heart disease and strokes. So we have to also add this to the barriers in accessing preventative care and advancing treatments and diagnostic technologies because the scope of the problem becomes, even more evident that we don't have representation to understand how medications and treatments impact black populations fully. Um, this exclusion perpetuates the cycle of inequity with African Americans without specific, tailored treatments. And so, taking steps towards change requires building trust in a healthcare system where cultural competence and ensuring that providers understand and respect the diverse populations is a necessity. Um, Oftentimes we don't see transparency in healthcare delivery. We don't see research that intentionally includes diverse populations that would be vital to addressing the systematic barriers that we face. Medical apartheid sheds light on the profound legacy of unethical medical practices targeting African Americans. This mistrust that we often see in our communities is not just a relic of the past, but it actively shapes modern healthcare disparities. In a review of references for while reading this book, because I said, what's going on now? I was curious as to what was going on now. I discovered a study by Anderson et al. From 2021 that highlighted how implicit biases in pain management has led to black patients being systematically undertreated for pain, perpetuating continued stereotypes about pain tolerance. In my community, there's almost like a pain management clinic on every corner, but to imagine even now those systems still are not meeting the needs of the communities based on these biases from the slavery era that Washington has highlighted for us. And so, within their study, Howell et al. Brought to light the disparities also in maternal health care, demonstrating that black women in the U.S. are 3 to 4 times more likely to die from those pregnancy related um, causes than their white counterparts. And these are not isolated issues, but symptoms of a more systematic problem in historical ongoing issue that Washington highlights for us and explores. Um, One of the things that seemed to resonate with me was that in addressing the trajectory, we had to address the systemic racism head on. Healthcare institutions have to acknowledge that the historical injustices that created these disparities have fostered a culture of accountability and reform and emphasizing the importance of reducing having medical professionals that utilize this implicit bias to make decisions and medical professionals that want to build trust, that want to build equity in patient care, that care about who they're treating and look beyond the color of their skin. Ethical principles like informed consent and patient autonomy, they have to become cornerstones of healthcare delivery. And then transparent communication, ensuring that everybody feels seen, they feel heard, they feel a part of their healthcare decision, which will require research from populations and clinical trials and ensuring that treatment is equitable for all people. And so the path forward requires reforms that confront the past and dismantle structures perpetuating perpetuating issues um, within the healthcare system to improve healthcare outcomes for African Americans. And so, lastly, just my final reaction and my conclusion to medical apartheid. Um, this book was more than just a history lesson. I remember first picking it up when I was on a flight to Philadelphia, and that was the wrong thing to do because you probably could see the steam coming up from my head as I was trying to process the information that I was reading. And this was back in August. So we're in November, and I just finished it. Not because it wasn't an interesting read, but because um, the election cycle, there have been a lot of prominent stressors that are undertones of racial bias and things going on in the community. So this book hit me deeply, and it did take me a while to get through it. Just the revealing intentional and systematic neglect of black bodies throughout history. And while I had some knowledge of it, the book brought a sharper focus on the foundation that the communities like mine carry, such as myself. I carry these as well when I engage in the healthcare system. The journey of this book actually became personal because it reinforced a dream that I've had, which is creating a space for my community where they can feel seen, safe, and respected. I work as a psychotherapist in private practice now, and my husband is an African American primary care provider here in our community as well. So we've been together for a long time. We actually completed our degrees a little bit later in life, but one of the things that we talk about all the time is developing a private clinic where we combine both of our life's interests, which is primary care and behavioral health care, in one setting. So basically, a holistic healthcare model where people can go see their primary care physicians, and if they need a referral for mental health support because of stress of their life, they could come over and see me. And so it's funny, we're now preparing to attend his company's Christmas party, and every year that we go, we are two of four African Americans in a room of 250 people. So his healthcare system, they actually have about five black primary care providers, but that's a very minuscule number on the grand scale of things. So out of 400 providers that work in our community, only five are African American, and they work in different disciplines. And so he and I both just envision a space where healing is not just physical, but it also addresses the emotional and psychological scars often inflicted upon the people that I primarily serve, which are African Americans. And so my work as a therapist has shown me that health can't just be compartmentalized. And especially given the presidential election results and the return of the Trump administration, the possible dismantling of policies like the Affordable Care Act and access to Medicaid, which would directly threaten the people that we serve. I worry about how those policies will unravel in my communities. And so I hope that earning my PhD from Alabama A&M will be instrumental in helping both my husband and I achieve this vision. And I hope that the program will continue to expose me to these actions so that we can develop some solutions and bridge the gap in care, and also let our people know that there are black and brown people in your communities that you can turn to working in these fields now. And so you can come where you will be heard and supported. I know African Americans, we're very good about community during times like this, so that's another reason why this book kind of promoted that thought process for me. And just as I close, I just leave you with, the book showed me that it's not okay just to highlight what's broken. It's a responsibility to fix it. And so the road ahead, though it maybe have challenges, it's not unattainable. So I want to utilize the skills that God's given me to be able to give back and to be able to provide representation in these fields. And so this was actually a good read. I'm going to pass it on to my husband so that he can gain a garner an interest in some of the stories of oppression that we were both unaware of. And I'm looking forward to just continuing to grow and find more information that Miss Washington has been able to share with us.